Okay. All right. Oh, and here comes somebody else.
That's
so
me. I'm doing a quick switcheroo because my laptop's dying.
Oh, got you. Okay, so that's you as well.
Yep.
Gotcha. Okay, perfect. All right. We'll just give Ali a moment to come back with us here.
Ah.
You are? All right.
I'm Owen today.
Okay, perfect. All right. So we're going to start by just cradling the head. And so when you cradle the head, you know, kind of having some curl in your fingers. You don't need a really stiff, you know, connection to the back of the head, but more like you're meeting the back of the skull where all those muscles of the posterior neck attach. And your fingers are kind of just coming up into that, you know, very bottom part of the skull where you feel the tension of the posterior neck muscles there meet your fingers. And then what we're going to do with our partners is just have them take a few deep inhales and exhales and let them just settle their body so the weight of their head should come more fully into our hands. Yeah, go ahead, a couple of deep inhales, followed by long, full exhale. I usually just breathe along with them, helps me center and ground myself. Now, if you ever are doing this, and if you're doing it right now and you feel like the person's head that you're working on isn't fully relaxed into your hands, one little cue you can give them is to have them push their head back into your hands and then relax. So sometimes we put our hands underneath someone's head and we can tell they're holding on to their head, like you can literally feel like the weight of their head is not in your hands. It may be that the people that you're massaging there have got this and they're totally relaxed right away. I know my person here is relaxed right away. But if you find that, it's a helpful little hint. You just say, push back into my hands and have them do that. And you can count to 5 or 8 or whatever, and then say, and now take a big exhale and relax. And that usually gets people to drop their head back. Okay, so now what I'm going to do is just start to gently move my fingers. I'm going to move my fingers kind of in a forward and back motion. So the palm of my hand stays right where it is on the back of the skull. It's not moving at all. My fingers are just doing this small little forward and backward movement. So what we're doing here is we're kind of addressing these muscles that we've been hanging out, just parked on, just giving some pressure to, and now we're moving with the direction of the fibers up and down. And you may find that you are slowly sinking in, and it may feel different one side than the other. So just notice that. I would say don't force the side that's resisting you. So if there's some more tightness in one side, it's better to just wait for it to relax. And you could try just going back to stillness again and see if that allows for more release. Sometimes movement works better and sometimes stillness works better. So it's good for us to just be perceptive to how things are going. And if one thing isn't working, then switch it up and do something else, because everybody's body is different. Okay. And now I'm going to keep my palms right where they are and start to move my fingers in kind of more of a circular direction that goes inside to outside. So towards the midline of the body, out towards the ear. So you're just switching the direction so that you're doing more of a cross fiber here on these muscle fibers. It's like your fingers for both hands are moving towards the other hand and then moving back away from the other hand. And again, your palm stays right where it is. These are little small finger movements. And it doesn't take a lot here. So this should be super easy on your hands. Your hands should be relaxed. You'll find that the cues that your body gives to someone, if your body is relaxed, it'll help their body relax. When we're holding tension in our own body, then the person that is perceiving our touch is also noticing that tension. All right. So now we're gonna kind of just slide our hands out, and you wanna find this bony protrusion behind the ear. You may know the name of it, the mastoid process. So it's right behind the ear, it's a bony area, and we're just gonna do small little circular frictions there. So your fingers are just coming like this, making a small little movement right on that bony area. It's a broad area, so you can kind of come under it and around it. There's a lot of musculature attaching here. You'll notice that if you come to the front side of it, you kind of drop into a little space between this bony area and the ear. Don't push deeply into that area. It's kind of a vulnerable little area there. So it's okay to use more pressure on the bottom side of it and on the back side of it, but on the front part of it towards the ear, you want to go easy. And again, just notice side to side differences. Is there more tension on one side? Kind of make note of that. We're going to come back to this area and address some of the muscles, but right now we're just making note, and then we'll also see how it changes. Okay, and now taking your hands a little bit more broadly, we're going to kind of just come up from that landmark behind the ear, and we're going to give a little scalp massage. So starting out just kind of right above the ear here, we're actually going to be getting some of the muscles of the jaw. So here on the side of the head is the big temporalis muscle. So this is a thin muscle. It's right against bone. You'll feel that it doesn't feel very deep or thick here. It just feels like you're massaging someone's, scalp itself, like the bones themselves. But there's muscular tension held there. So keep your pressure light. You can come up and you'll still be on that muscle. It's a pretty good sized muscle, kind of comes all the way up, side of the head here. And then we'll just come up to the top of the skull. And again, kind of using your fingers like this. Just massage the top of the skull. Your person is probably already drooling and quite blissed out. This is good. We're going for getting them good and relaxed here. All right. And if the person likes it, you can kind of take your hands like this and just grab a little bit, just kind of coming in like this, like your fingers are going to be like a comb, and just grab a little bit of hair. Well, if they have hair, you may have a bald client. Yeah. I realized that after I said it, Steffi. So if they don't have hair, then yeah, you pull your own. No, don't do that. Come to the sides. Maybe you can grab up a little bit of those eyebrows, Steffi. All right, so little gentle hair pull. All right, so now we're just going to bring our hands to the tops of shoulders. And you're going to take one hand, and with one hand reach underneath the neck and scoop up their head so that you're holding right at the base of the head. Your hand is sort of cupped like this. So you're holding like this with one hand. With the second hand, you're going to place it at the top of the sternum, which is also, people also call it the breastplate. Yep. And here, what you're doing with this hand is you're not pushing down into the body, but you're going to give this kind of gentle sliding pressure towards the feet. Now, once you engage that pressure down towards the feet, then go ahead with the hand that's on the occiput. Just think about pulling it back towards you. You don't need to use a lot of effort in that, but it's a gentle traction of the neck while we're holding this engaged traction on the sternum. And again, you could have your partner here take a deep inhale and exhale. And just follow that breath as you hold that stretch of the sternum. We're releasing some of the anterior neck tension. Okay. So now we're going to do a little bit of anterior neck work. This is going to be just kind of real simple anterior neck work. We're going to go for these big muscles here that are called sternocleidomastoid. When I turn and look over my shoulder, there's a big muscle on the right side, if I'm turning to the left, that pops up between that mastoid process we were just palpating and the sternum that we just had our hand on. So if you pick up your partner's head a little bit, so now I have my hand underneath my partner's head, then come back to that mastoid process behind the ear and notice the muscle that's coming from the mastoid and angling down towards the sternum. And if you have a hard time finding it, all you have to do is have your partner at this point look in the opposite direction and turn their head just a little bit opposite of the side that you're palpating on. And then that pops that muscle right up when they turn their head and neck, okay? You can bring them back to center if you have them turn. And what we're gonna do here is this little kind of pinching grip. They call it a pincer grip. The thing to note about working here at the neck is that the carotid artery lies just inside of this muscle. So we don't wanna use a big push here. We wanna use a gentle little lift. So you're grabbing it, and I usually actually use my thumb and a finger. So you're grabbing this muscle, and it's easiest to kind of pick up if you have their head lifted up, because if you don't lift up their head, then it holds a little too snug towards the body. So now I can pick this up. I'm doing this gentle little pincer grip. And yeah, you can start by the mastoid, and then you can actually see it on my partner right here. There's the muscle right there. And I'm picking it up, and I'm gonna just walk down this muscle. When you're grabbing with the thumb, make sure that you're being careful not to plunk the thumb into the carotid artery there. It's also super important that we work one side at a time with this method in case we aren't paying attention to the fact that we are actually occluding the carotid artery, which would be really bad, blocking the blood flow through it.
My partner said, I wish I hadn't heard that you're touching my carotid artery.
Oh dear. Sorry about that alarm. We're going to stay clear of the carotid by just lifting this muscle up. We're actually going to make it so that that carotid has a little bit more breathing room there. It's all good. Lots of blood for your brain. Okay, perfect. So now we're going to switch and do the other side. So you'll just switch and place a hand underneath the head. We're intentionally lifting the head up a little bit. So not so much that you're having to hold your arm up, but just by propping their head up is usually enough. Now, if it was hard to grasp this muscle, you could always put a towel under their head to hold their head up a little bit higher. And then again, gently using this little pincer grip. And when you grab with your thumb there, Allie, you don't even have to go as far medial as you're going. Make a smaller movement with your thumb. There you go. Perfect.
Thank you.
Yeah. So you just find that edge of that muscle and you never leave the edge. You don't have to grasp beyond it. Because then people feel a pull across the front of their throat and then it feels a little choky to them. Which is why some people don't like anterior neck work, because people like, you know, do it a little bit more aggressively than they should. And then the person feels this like fear come up because, I mean, we protect this part of our body for a really good reason. And it's tight on us. And so, yeah, so if it feels choky, then it alarms the person, sets off a little alarm in their body, which is not what we want to happen. Okay, good. So after you've made a couple of passes going up and down that, you can release their head back down. And let's just do a little push on the shoulder. So we're gonna have hands on both sides, and you can do it a little alternating. It's like you're pedaling, like push down on one shoulder and then on the other. So back and forth, one side to the other. We're kind of just checking the shoulder mobility here. Notice if one side goes down easier than the other. Notice how it comes back up. And again, this is a good place to have your partner take a deep breath and a big exhale. We don't realize how much we hold tension in our shoulders. We kind of just hold them up like this for no good reason. There's really a good reason, actually. The reason is to protect your neck and throat. That's what you're doing. It's instinctive. All right. Good. Great. Okay. So now we're going to do a little bit of work on the back of the neck. And for this work on the back of the neck, what you're going to do is you're going to use a broader hand. You're going to slide a hand out underneath the neck and across. And you'll do one side where you come slide underneath across, and then the other side and slide underneath and across. So as you do that, try to kind of slowly engage and feel the tissue as it moves through your hand. So it's a slow spreading. And it's light enough that we're not like, you know, being pokey with the vertebra back here. So we're not engaging those vertebral processes. All right. And now that we've done that, we're going to take both hands and we're going to have our hands sort of like this. And we're going to pull through the back of the neck, where this is going to be a little bit of traction. This traction, we don't want it to start out as a big pull, because what we want to check is see how their neck feels about traction. Some people's necks say, yes, yes, more, and other necks are like turtles and go, nope, that's plenty, thank you. And so start with just a little gentle pull and see how their neck reacts. If their neck pulls back, then lighten that up a little bit, give back to them, okay? And this will be holding your hand steady here, so you're going to stay with this traction. And then as you're staying here, it could be that you begin to lean back a little bit and add a little bit more traction. But as you do that, do it gradually so that you notice whether their body again pulls back and says, no, thank you, that's plenty. If the body perceives a stretch and it doesn't feel like it's a stretch that it can accommodate, then it guards by pulling back. And so that's the turtleneck that I mentioned. It's a good point here to just check in with your partner. So we're listening for their body cues, but it's a good place to check in. How's this feeling for you? Yeah. I personally think I could have someone traction my neck every day and I would never get tired of it. I haven't had any volunteers yet that want to traction it every day. I need a little Dobby massage elf that just massages my neck daily. I would treat it so good. All right. So maybe you lean back a little bit more with this traction.
You must be a rock climber. You have strong hands.
Oh, I'm just been a massage therapist for about 28 years, Allie.
Oh man, my fingers are like burning.
I don't climb any rocks at all. That would take away from my massage power. How you doing? This pressure still good? Okay. All right. So go ahead and release their neck here. And now we're going to take one hand and scoop it underneath. So I've scooped this hand underneath, and we're just going to place our hand on the top of the head. And we're not pushing back down in the direction we were just lengthening, but we're just offering this little bit of any movement that comes here. So have the hand that is on the top of the head, not on the forehead, but right on the very top of their head. Like it's like you're going like as if you were going to push their neck back down opposite, but we're not pushing. We're just providing this little awareness of their body. And this may allow their head and neck to start to do it as a little gentle unwind. So this is subtle, but notice if you feel their head moving a little bit. It wants to wiggle a little bit side to side. This is in the very subtle arena of unwinding, but it actually, little unwinding sometimes is just perfect for a body. I'm feeling some circular motions through my hand.
I'm just feeling his heartbeat in the back of his neck.
Yeah, and you may pick up just heartbeat. I pick up heartbeat too, and I'm totally ignoring that. But like once you said that, I'm like, yeah, I can feel that too. Okay, great. So now we're going to do just a little bit of facial massage. And so I wanted to address both jaw tension and sinus pressure, knowing that those may be things that are up for people. So to address those things, we're going to start with the idea of sinus pressure first. And so the sinus cavities are in a lot of bones in your head. The bone of the forehead is one of the places that we have sinus cavities. And obviously, when we think about like what we want to do to ourselves when we have sinus pressure, we want to push on the bridge of our nose. That's kind of people's natural instinct, is to press there because there's sinus cavities that are in this little bone that's below the bridge of the nose. It's called the ethmoid. But so we're going to start at the frontal bone. This is the forehead bone here. So right above those eyebrows, what I tend to do is have my hands like this. I'm using this surface of my thumb like this, and I'm just going to start in the center and gently slide out towards the ears, coming straight across. This is gentle pressure. And the broader the contact here, the better. So imagine your thumbs like a little squeegee. If you were squeegeeing a little bead of sweat off of them, that's the amount of contact you want. We're not trying to push it into their head. We're just trying to squeegee it across. So come back to the center and do a few more spreads across. And now what we're going to do is we're going to use our hands and we're going to grip with 2 fingers and thumb. And this is, again, it's very light. I mean, this is on someone's face. So, scale it to like what's appropriate for someone's face. But you're going to be right on the eyebrow. And these 2 fingers are going to kind of scoop in just a little bit into the orbit here. And we're going to slide across right along the eyebrows, being mindful of the eyes themselves. So you're staying above the actual eyeball. No eyeball massage is good. We're getting the brow here. Okay. And now, right at the bridge of the nose, you can come in with just like 2 finger contact here and just be mindful of the rest of your fingers so that they're not landing kerplunk into someone's eye, right? So, but you're right at the bridge of the nose. And what we're going to do is follow down on either sides of the bridge of the nose. And you can kind of follow, depending on how old this person is, they may have some smile creases, they may not yet. But you're going to follow right down along the bridge of the nose and to the side and go down and follow this little line towards the jaw. Okay, so I'll do both sides at the same time. And again, have this pressure be kind of a squeegeeing pressure, nothing that's like deep. And 2 or 3 passes here. Good. Okay, so now we're going to come to the cheekbones. And at the cheekbones, you can probably get 2 or 3 fingers underneath it, and then your thumb is sitting on the top part. So again, your hand is sort of like this. And I'm going to do both sides. I'm going to start towards the bridge of the nose, and I'm going to slide out. I'm going down towards the ears here. Come back towards the center at the bridge of the nose and slide out.
Where exactly should my thumb be?
Your thumb is sitting right on top of the zygomatic arch. So we're right along the zygoma bone here, which joins with the temporal bone to make that zygomatic arch. And we're starting towards the center, which is part of the zygoma, and then we're sliding across that. So if you kind of just straddle that bone, Steffi. If they have any sinus pressure, this is a really nice place for releasing that. Okay, so now we're going to do a little acupressure hold. So this acupressure hold, you're going to do it on both sides. You're going to have your thumb right above the pupil of the eye, just above the eyebrow, and then a finger. So you're going to have 2 points of contact, a thumb and a finger. One is right above the eyebrow, right in line with the pupil of the eye, and the other one is just below that cheekbone, and again, right in line. So if you had a line right through the center of the pupil of the eye, you're lined right above it and right below it, and you're doing both sides simultaneously. Now this is a static hold, so we just hold our hands here with these pressure points. It doesn't have to be really deep pressure. And again, you might pick up heartbeat here. It's possible. You might feel it in your own fingers as well. But what I want you to try to see if you can notice is if you can notice some energetic movement between your fingers. So between these 2 points.
Feel a lot of heat in the tips of my fingers.
Yeah. And so what we're hoping to feel is kind of some evenness between the finger that's above, the thumb that's above the eye, and the finger that's below. Like just this sense of it bouncing between the two is what we're going for here. So if there feels like there's more concentration of that heat, or you feel more of almost like a throbbing in one point, then you're waiting for it to pass through to be connecting to both. Okay. So now we're going to do a little bit of more release for the jaw. So the jaw here, the temporomandibular joint, is right in front of the ear. So if you come kind of right in front of the ear, we're just going to do some little gentle circular motion here. And then what we're going to do is we're going to slide down the length of the masseter, which is one of the main muscles of the jaw. So that could be right along sideburns and beard there. All the way down the jaw. Now, if the person you're working on is awake, my person is not anymore. Oh, I just woke her up by saying that. You can have this person Take a deep breath, and on the exhale, let their jaw soften. And then, so go ahead and inhale and exhale. And then as they soften, slide down the length of the jaw and just exaggerate that release of the jaw. Go ahead and do that again. So it's an inhale. On the exhale, they just let their jaw drop. Like you're just going to let your mouth gape open. There you go. It's okay to let those mouths just gape right open. I know we're so tight jawed in this country that you tell someone to relax your jaw and they're like, it's relaxed. Hard to let that go. Great. Okay, now we're going to come underneath the jawbone here, the lower jawbone, which is the mandible. And there are glands in this area, so you want to be careful about the amount of pressure. But again, you're kind of using your fingers like this, and we're just going to come from the center right under the chin and just slide gently underneath the mandible. Don't use a lot of pressure here. So you're going from the chin, kind of again, back towards the ears.
Are you doing more pressure in your fingers and less in your thumbs, or equal?
Equal, and I really am not using much pressure at all. It's just a really gentle slide across. You especially don't want to use a lot of pressure in your fingers though, because underneath this bone are glands and we don't want to press into the glands. So we're going gently over the surface here. All right. Now, let's come up to their ear, and unless the person you're working on is opposed to the idea of you're working in their ear, we're going to massage their ears a little bit. It's okay to kind of work the surfaces, so the cartilage of the ear, get into the ear itself. Some people really like this, and other people it weirds them out. So you really have to check in with your client. If you don't know their preference, then make sure you ask, don't assume. It's one of those areas that's either a yay or a nay, and we don't want somebody to be like, that was weird. And then what we'll do is we'll just sort of, again, gently grasp, and we're going to do a gentle little pulling out. So this isn't a big tug. It's just a gentle pulling out in both directions. So imagine you're making their head bigger, but you're doing this in the most subtle way. How's that feel? Interesting. So see if your partner likes it. Mine said it was interesting. Interesting, good or bad? Yeah. Okay. I decided I should check further on what that interesting meant. All right. So let's come back to the scalp, and we're going to finish with just a little bit more gentle scalp massage. After you
so hard here in the sun.
Yeah, I know. After you replace those sunglasses, that's perfect. Okay, and then we'll come back to this little shoulder push, one side then the other, and just notice, is it different? They may have relaxed some of these muscles just by relaxing their head and neck. Okay, cool. So I just wanted to check in and see if either of you have any questions, or if your partners who are getting massage have any questions.
No, that was great. Very relaxing.
Excellent. Steffi, you got any questions?
I don't in this moment. Sorry, there's many things happening in the second, but the ear was interesting. What exactly is that doing?
Well, so you're just giving a little like gentle stretch. we don't think about ear tension, and there's a whole bunch of little muscles that surround the ear, but the tension of the jaw also kind of pulls on the ear itself because of the temporal mandibular joint. So you're just giving a little stretch. It's actually kind of a small little decompression of those bones. Kind of like when we were pulling and tractioning the neck, we're decompressing the vertebral column. We're just decompressing the head a little bit there. Yeah, it's a great question. Okay. All right. Well, I think that we'll wrap up here.